Hello, and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm talking to the Royal College of GP's Vice Chair for External Affairs, Dr Victoria Tzortziou Brown, about achieving parity of esteem for general practice. Earlier this year, the college published a statement setting out a number of steps it said needed to be taken to ensure general practice was treated on a par with other branches of medicine. The college argued that failure to recognise general practice's role as the cornerstone of the NHS was driving underfunding and perpetuating the GP crisis. In this interview today, Dr Tzortziou Brown explains why achieving parity is so important and talks through some of the recommendations the college has made, including how to tackle inequalities in training, education and research, why we need steps to limit workload in general practice, and the importance of greater representation of general practice in leadership roles both locally and nationally. We also talk about how the college hopes this strategy will develop in the coming months. Just before we start, a quick message. If there's anything you would like to see covered in future episodes of Talking General Practice or important topics you would like us to discuss, please do get in touch. You can email us at gppodcast@haymarket.com. I'm delighted to be joined on the podcast now by Dr Victoria Tzortziou Brown, who is the Vice Chair for External Affairs at the RCGP and an academic GP at the Wolfson Institute of Population Health, which is part of Queen Mary University London. She's also the Research and Innovation Lead for North East London Integrated Care Board, where she works with stakeholders and local communities to embed relevant and inclusive research that aims to improve the lives of people who live in the area. Thank you so much for coming on the podcast, Victoria.
Thank you for having me.
So you're here today to talk about a statement which the college recently put out about achieving parity for general practice. Can you just explain a bit what the driving reason behind that statement was?
There have been long-standing concerns by GP members on the inequalities faced by GPs and also general practice compared to other medical specialities. So we know that it was 2016 that a report was produced with the title By Choice, Not by Chance. And that report highlighted that medical students at the time experienced a very uncomfortable divide between primary and secondary care. And this often led them to perceive general practices of lower status. And the report at the time proposed recommendations to address this. And we have made some progress since then, but we are not there yet. A member motion came to our council in June last year, in 2023, and this was overwhelmingly supported by our council and asked us essentially to look into this issue, develop a position statement, and also identify priorities for action.
So when we talk about achieving parity for general practice, what is the Royal College of GPs aiming for?
Well, there are examples that GPs and general practice continue to be undermined, and this needs to change. So we would like to achieve parity whereby general practice, both as a career and also as a specialty, is fully recognized, appreciated and valued within the NHS by academic colleagues, by policymakers and also by the public.
The statement covers a number of issues which we'll come on to talk about in a bit more detail in a minute, but how did you actually go about putting that statement together? Was it based on feedback from college members, or it was more about talking to people within the college?
A little bit of both. Our policy team undertook this work. It did consult with members. It also consulted with some academic GPs for the academic part of the statement. And we have also undertaken a small member survey asking for examples and experiences of members of inequality or unequal treatment. And these help us formulating solutions. And also we'll keep working on this so that we can consider what other further action we can take going forward.
One of the things that's quite important, really, I mean, you talked about general practice as a specialty being not seen as equal, but the statement sort of warns that a failure to recognise general practice's role as the cornerstone of the NHS is driving underfunding and perpetuating the GP crisis. I was wondering if you could explain a bit why that is. Is it primarily because policymakers are consistently undervaluing the role that general practice plays?
The reasons are very complex and probably there are many factors there. I think partly the underfunding is due to historical reasons. So we know that general practice is funded by a capitated system, and this means that activity is not taken into account in the same way that it is taken into account for hospitals. There are currently few limits really to the quantity and rates of services that GPs are expected to offer to our patients. And all this is for very, very limited funding. The proportion of the NHS budget that goes to general practice has fallen, as we know. It's now at the lowest level since 2015, despite the fact that general practice has been delivering 20 or 30% sometimes more appointments compared to what we were doing before the pandemic in 2019. So the college is asking for the introduction of a national alert system in a similar way that there are alert systems for hospitals, which essentially recognize that demand may exceed capacity and puts in place escalation processes. But we also have, apart from the underfunding we have and the unlimited demand within general practice, there is an increasing shift of unfunded work that comes from specialist care to primary care. And this is increasingly a significant problem with commissioning systems. And I worked for CCGs before, and now we have ICBs. They have not managed to address so far. So both we at the RCGP and also the BMA have produced advice on this, what we call interface working, and how we should not accept this transfer of work. But without system support, it can be very difficult for us to push back. So I think general practice is both undervalued, it is often taken for granted, and it is expected to absorb all these kind of rapidly increasing demand without adequate extra resources. And this is exactly what we need to challenge and change going forward.
And is that part of why you're doing this work, really, to kind of highlight all the areas where general practice is perhaps not getting the same recognition, treatment, support that secondary care is?
Yes, absolutely. It's fascinating to see the discrepancies both in funding and how general practice is perceived and valued in different policy documents that have been produced.
The statement highlights all of these different areas where there needs to be steps taken to achieve parity. And one of them is it highlights there's a lack of protected time for planning, supervision and professional development, which is something that colleagues in secondary care would have. Now, obviously, this affects all GPs on an individual level. What sort of impact does that have?
Because of our increased clinical workload, and both in number and actually complexity as well, time for supervision and also for professional development, as you said, is very, very limited. And this is at a time when also we are asked to supervise or give advice to even a larger number of trainees and other members of our teams. So we did an RCGP survey recently, and we undertake this service yearly. And what came out from it is that 60% of GPs say that they don't have enough time to undertake professional development. So the lack of time can have a significant impact, as we know, on GP morale. We know this is very low at the moment. And what we are asking as a college, as part of our manifesto as well for the general elections, we are asking for a fully funded one-stop retention program, which can support GPs at all stages of their careers to develop new skills, to engage in learning activities that can assist them essentially to develop sustainable and fulfilling careers going forward.
One of the things we also covered a lot on GP Online over the years, and you kind of touched on it a bit earlier on, is the denigration of general practice in medical training. And this false idea that medical students often hear from people training them that being a GP is, in quote marks, an easy option. We do have record numbers of doctors going into GP training now, but do you think that attitude still persists in medical schools now? And if so, what impact does it have?
Well, this was certainly, as you say, was highlighted at the report by choice, not by chance. Since then, a lot has been written on the subject to highlight the issues. I have not data to say with certainty whether things have improved. However, in view of the establishment of the GP societies now in the majority of UK medical schools, and also in view of the record numbers of applications that we had for general practice training places last year, I would like to think that some progress has been made. But it's not just what people say, it's sometimes what people do as well. So, for example, when secondary care discharges patients back to the GP with often unclear communication or with an expectation that the GP will pick up and chase specialist tests, without any extra funding, without any extra resources, I think it all comes down to recognizing the pressures that general practice is under and valuing the fundamental role that plays in the sustainability of the NHS and protecting it.
Yeah, I suppose because if medical students are in those environments in hospitals where hospital colleagues are being like that and taking that attitude towards general practice, people who are learning must sort of pick that up as they're going through training, mustn't they?
Exactly, yeah.
One of the ways to potentially combat this, and this is something that's been talked about a lot over the years, is for medical students to spend more time in general practice, so they're exposed to the reality of what it's like to be a GP and the pressures that GPs face. It is part of the NHS long-term workforce plan in England that all foundation doctors will eventually have to spend some time in general practice. But have we seen any progress on foundation doctors, medical students spending more time in general practice? And what difference do you think something like that would make?
Indeed, the long-term workforce plan says that all foundation doctors should spend at least 4 months in general practice. But this will take another probably 4 or 5 years to materialize. These placements are becoming more common. We don't have exact data, again, on how common they are at the moment and how far we have to go. But at the same time, while these promises are made, we will need to create the capacity in terms of physical space and supervision capacity within general practice to support such initiatives. And at the time, the college has suggested that all hospital specialty training programs should include time spent in general practice too. And this would be really positive, I think, because it would help all doctors to understand and appreciate general practice, and it would probably result in better interface working, as we mentioned before, but also better relationships and collaboration between primary and secondary care. But again, we will need to create the capacity within general practice to accept all these trainees within our settings, and so that they feel welcomed rather than they feel that we don't have enough time to spend with them, and therefore we make them feel like they are an extra burden we have to deal with.
It's quite interesting, isn't it? Because I can see that in future, having more doctors spend more time in general practice, whatever specialty they end up going to work in, it can only really be a benefit, because obviously more and more people are going to be living longer with more and more multiple conditions. There's a general recognition that people are going to have more generalist skills to deal with the consequences of having an ageing population. So I can imagine it could end up being quite an important part of medical training. But as you say, there's so many problems with estates and the space that it's quite hard to see how we're going to get there, really. One of the other things that you talk about in the statement, and it's something we've written a lot about and actually often gets a lot of readers on the website when we've written about it, is about merging the specialist and GP medical registers. Now, the government put forward proposals for this to happen in 2021, but legislation's still not been tabled. Why do you think it's important to have one register which has all specialists and GPs on it rather than two separate ones?
Because it gives a clear message that GPs are specialists, they are senior doctors in equal standing with colleagues in secondary care.
Yeah.
Actually, we did revise our definition of what a GP is with our council recently. And within that, we explained that the role of the GP is to be an expert medical generalist, what we call a consultant in general practice, with this kind of distinct expertise in providing whole person medical care, managing complexity, uncertainty, and risk. So merging the two registers will give this strong message that we are specialists.
Do you have any sense about if that's likely to happen? Because it seems that everybody thinks it's a good idea, and I think it seemed to get bogged down maybe in the pandemic, and now it's kind of, I haven't heard anything about it for quite a while. It's almost like it's gone on the back burner. Do you get a sense it will happen at some point? Are things moving on it, or has everything just gone quiet?
I'm not quite sure of the timelines. I do hope that it will be picked up again, these conversations. Certainly as a college, we have been pushing for it.
One of the other things that the statement talks about as well, which is also really interesting, is discrepancies when it comes to academia and research in general practice when compared with other settings. I mean, this is obviously your area of expertise. Can you explain what some of the problems are around this and what needs to happen to address those challenges?
First, I would like to reflect a little bit actually on the history of the college because it's relevant here. So the RCGP was founded in 1952, so 72 years ago, in response to growing administrative and financial pressures at the time that very much demoralized GPs and undermined the standards of patient care. And a few influential GPs at that time began to develop this idea of a college, which they thought it would be an academic body that would support good standards of practice, but also education and research in a similar way that was happening with other medical colleges. So I think it is really important that general practice is recognized as an academic, intellectually stimulating, challenging speciality, because it is. However, there is limited capacity within general practice at the moment to support research and also education to a great degree. And the number of GP academics, as we know, significantly lags behind compared to secondary care. At the same time, there are significant opportunities now to embed research in general practice because we know we have very rich data. Our data spans across 3 decades. We see patients throughout their lives, and these opportunities have been picked up by policymakers, and there is more and more interest and recognition of the need that we need to encourage more research within general practice. But this needs a system-wide kind of sustained commitment to support progress, and the commitment needs to be from universities, from funding bodies, from the NHS. It needs to include adequate staffing within academic primary care departments. And also we need to increase the academic and research opportunities for GPs, not just at the beginning of their careers, I would say at all stages of their careers, because it's never too late to get involved with research, I feel. So this would definitely be a worthwhile investment, in my opinion, because it would result in more educators. We are desperate for more educators with the increase in medical trainees, but also it would result in more research being undertaken in GP settings and therefore better, more evidence-based care for our patients.
Just as an aside, if there's anyone listening to this who's they are interested in getting more involved in research, or their practice might be thinking about it, what's the best way to go about that? What can people do if they want to do that?
So there is information on our website. We have a program called Research Ready for practices to just get the first experience and a little bit of training on how to go about upskilling their staff and getting prepared as an organization to support and participate in research. But also, I would advise interested colleagues to liaise with their local academic departments and also with their local CRNs. And there is a reorganization within NIHR at the moment, but there will be local departments that are funded to support research in primary care. And there are lots of opportunities there to actually engage with.
Is there more research going on in primary care than there perhaps has been before? The reason I ask is obviously population health management has become increasingly important from NHS England's point of view. It's what integrated care boards are kind of charged with doing. It's very central to what primary care networks are doing. So obviously that is all based on data and looking at data and surely taking interventions and then seeing what happens as a result of that. So does that helping at all to push forward more research in primary care?
Yes, understanding how to use data and interrogate data and reflect on it definitely helps, especially with quality improvement. In terms of research, there has been an increase, and we need to try to maintain it and support it going forward during the pandemic, of course, because we had studies like the panoramic study, which was recruited lots of patients within general practice. This helped a lot and exposed people within primary care in research and helped them to understand the value and the immediate benefit as well to patients. But we need the resources to actually build on that and ensure that we sustain this progress going forward.
The other areas that the RCGP statement about parity, which we haven't touched on yet, that you want to see action on is improved representation of general practice at leadership levels, and that's both locally and nationally. The statement talks about the fact that ICBs have a much higher representation of secondary care specialties than primary care. In your experience, what's the impact of not having adequate representation of general practice in these kind of positions?
So I have been involved in commissioning for quite a long time, and now I'm very close to the workings of our ICB in North East London. And I think as ICBs in particular are being delegated greater responsibility for allocation of resources locally, I think it's fundamentally important that they have sufficient GP representation, not just on their boards, but also within their clinical leadership at both system and place levels. So both at the ICB system wide level and a more localized level, including PCNs. And as GPs, I feel we bring these unique kind of system insights when we are in such positions. So, for example, we have a good understanding on how local services work, where are the gaps, where are the inefficiencies, which areas need to be prioritized. And also, we see over 1 million patients every day. So, we have a very good understanding of changing patient needs. And a lot of the time, we act as patient advocates too. So, the other benefit is that we don't see single diseases. We uniquely deliver this holistic person centered care while at the same time holding responsibility for population health, as you mentioned before. So, from my clinical commissioning experience, such skills and insights can be brilliant, can be really useful when making decisions on system redesign, transformation of services, and the efficient and fair allocation of limited resources.
What does the college think needs to be done to help ensure there is more representation of general practice in these leadership roles? What does the NHS need to do? What can the college do, for example, to help this happen?
Well, firstly, these kind of unique insights and skills need to be recognized.
Yeah.
Secondly, there need to be probably more opportunities for GPs to develop these skills even further throughout their careers. So, including mentoring opportunities, training opportunities for leadership, and this could be part of what we suggest as one-stop retention scheme that we are asking for. And the third thing is that GPs need to be supported and invited more to take on leadership positions at local and national levels. Such roles need to be contracted and remunerated in the same way it happens with secondary care colleagues, not less. Leaders in such roles need to feel included and valued. They need to feel safe to constructively challenge and empower to support the innovation and transformation that we need. So, if we are to shift more care from hospitals to the community and primary care, and if we are to move towards creating these kind of learning systems focused in quality improvement that also reduce health inequalities, there will have to be a commitment to better support GP leadership going forward.
One of the things that's quite interesting about this is that some of the things that you're talking about that need to happen to achieve parity, they will require some kind of investment and money, won't they? But then your argument is also that without achieving parity, general practice will never get the kind of overall investment it needs. What do you think are the most important things that need to happen from all of this to start making progress on it? What would be the first thing you would like to see happen?
Oh, that's a difficult question. I would say all of these are quite important.
Yeah.
Certainly, recognizing the value of general practice for the NHS is especially important because, as I mentioned before, we do see over 1 million patients a day. We are the first point of contact for patients. And if general practice fails, the whole NHS is going to fail. So the question is, how do we support general practice so that the rest of the healthcare system can operate in a very efficient way? And this investment, it's a very minor investment compared to the total NHS budget, but it will make such a difference for general practice and for our ability to respond to patient need.
Now you've got this statement, how's the college going to use it going forward? Is it just so you've got like a framework within which to push for certain things? How are you planning on using it going forwards?
So some of the actions to be taken forward are incorporated already within our manifesto for the general election. So we will be using these proposals in our conversations with policymakers and politicians. But also, this is work in progress. So as we understand better the experiences and suggestions also that come from our members, we will build on this work and we will hopefully generate further solutions, and we will keep lobbying for better recognition of general practice and parity going forward.
Thank you so much, Victoria, for taking the time to come and speak to me today.
Thank you for having me.
Well, that's it for this week. Thanks so much for listening. During that interview, Victoria mentioned how the RCGP was founded, and if you want to find out more about that, we have a really interesting article on exactly that topic in the archive on GP Online, which we published to coincide with the NHS's 70th anniversary a number of years ago. We'll put a link to that article in the notes for this episode. I'll be back next week with Nick and Kimberly for our regular news review, so please do join me then. In the meantime, you can keep up to date with all the latest news affecting general practice on our website at GPonline.com.